Good afternoon, everyone. I'm happy to be back. I was here last year as well. For those who were also here, you may remember that I talked a bit about MSF, Médecins Sans Frontières, or Doctors Without Borders, access campaign and the work that we do. We exist this year. Our access campaign exists 20 years. There's a brochure in the package that you received. There's a magazine with some of the work that we do. For about 20 years now, we are advocating on better access to medicines for the patients that we serve and that we treat to give them better access. So more affordable medicines, adapted medicines to their needs, as well as just making the medicines available for them in developing countries where we usually work. Today I will speak about transparency. I think it's important to understand that a lot of the public prices that you may find in the public domain are actually not the real prices that governments pay. That's the list price. What we see, at least for the expensive medicines. What often happens is that governments will negotiate a price and the companies will tell them, you can get a better deal, but then you have to sign a confidentiality agreement, a secret agreement that you cannot share this information with anybody else. It's only for you. And this is a very compelling argument for governments to get this discount, to get this rebate. And as such, we really have an atmosphere of secrecy around the prices of medicines and the cost of research and development. I will make the case today that transparency can really be an enabler of better access to medicines and more affordable medicines on the long term, and that there are very concrete opportunities happening in the next months to move forward and make progress. We heard some speakers already saying like we need to make some progress. There is a real case next month happening. So let's have a look at two examples. I present you one example from our own experience with the pneumococcal conjugate vaccine, or PCV vaccine from Pfizer. Pneumonia is a disease that particularly affects vulnerable populations, children, refugees, pregnant women, etc. Typically the kind of patients that we meet in our health centers. But there's a challenge, particularly in middle-income countries, with patients having to access or getting access to this vaccine because the price is too high for them. Middle-income countries have less financial support for healthcare and also pay higher prices than, for example, lower-income countries, the poorest countries of the world, let's say. So middle-income countries are somewhere in the middle. We've noticed, and I mentioned this last year as well when I was here, that in middle-income countries we see dropping vaccination rates. So actually there are less people being vaccinated every year in middle-income countries, kind of opposite of what you would expect. Pneumonia is a deadly disease. There are about 1 million children that die every year because of pneumonia, and that means that they were not vaccinated because it's an entirely preventable disease. So we were shocked in 2015 to see that two middle-income countries, Tunisia and Morocco, because these are the real prices, I forgot to mention this, but I'm showing the real prices, not the list prices, but the prices that governments really pay, are actually paying more than France. You can see that the price for Tunisia and Morocco is respectively 63.7 and 67.3 euros for a dose, while France pays 58.4. The dotted line is the GNI per capita, so the income per capita, you can say, so the kind of the level of wealth of that country. You can see how that's completely the opposite of the prices that the two countries pay. So this is illogical, it's unfair, and this is only possible. Morocco and Tunisia only can accept this price because they don't know that other countries are getting a better deal. So let's look at the second example, which is hepatitis C, and I'm very keen to speak after Michelle and hear also from her experience how of the challenges of access to hepatitis C treatment, sofosbuvir or Sovaldi. It's an issue, or it has been an issue, and it's maybe still an issue in Ireland, but it's an issue everywhere. There are about a bit under 70 million people worldwide that still require access to hepatitis C treatment, a deadly disease that affects the liver. And what we see, even in Europe, is that this medicine is being rationed. So that means that patients that it's reserved only, the treatment is reserved only for the most severe cases. That means as a patient, you know there's a treatment out there, but your disease has to advance, your liver has to be more damaged before you're able to get access to the treatments, which is unacceptable, obviously. So I collected some prices, not from our own source, but from CVO, which is a consortium of investigative journalists in Spain. They collected the real prices of hepatitis C treatments in 2017. And it's quite interesting to see that actually one of the countries that got the best price per treatment for a 12-week treatment course at the time was Switzerland, which is on the top of the rank of the GDP in this list, because I ranked the countries according to the GDP per capita, so their level of income or of wealth. Compare that to Poland, which has about a GDP per capita which is 1/5 of Switzerland, but nevertheless pays €7,000 more per treatment for the 12-week treatment course. I think it's also interesting to look at the price that we pay for the same 12-week treatments from generic, quality-assured generic producers around the world, which is €75 for the entire treatment, compared to over €40,000 for the same treatment. So that's kind of the level of exorbitant prices, or we can say abusive prices, that you can get for the same treatment. And this shows us, these two examples show us quite a bit. What this shows is how companies set their prices, which is to maximize the profit. I mean, in the end, they're private companies, so they aim for the highest profit. But they also aim for the wealthiest part of the population. This has been the case in Morocco and Tunisia very clearly. They aim for a higher, wealthier part of the population that actually can pay this vaccine. And the same is happening in Switzerland and here in Europe. Also, the lack of transparency here in Europe enables that if there would have been transparency, Poland would not accept that they pay a higher price in Switzerland. The lack of transparency as such shows that we only have the list prices, which serves as an anchor in negotiations. People think that other ones pay higher prices than they really do. So you don't really know, you have no indication what a good or a real price is. And you may think that you get a really good price when you negotiate 10-20% off the list price, but in reality, even Switzerland is still paying an excessive price with €37,000. Hepatitis C treatment was also rationed in Switzerland. But there's another point, just to say, transparency can enable lower prices. We have seen this as well with HIV treatments. As I said, we exist 20 years, the MSF Access campaign exists 20 years this year. We have been particularly involved in the strive for better access to antiretrovirals for HIV treatment since 2001. And one of the ways that we did this, there were several strategies that we followed, was also to publicly share information on the prices of antiretrovirals to enable price competition so that governments know what other ones are paying, that they ask for better deals and be stronger in their negotiations. As Bas mentioned, we need to be stronger in bargaining power. We need to have more bargaining power, or governments need to have more bargaining power. Information is power in this. Knowing how much other countries pay is power in the negotiations. But not only about what other countries are paying, but it's also about the cost of research and development. Medicines are not developed in a vacuum. They're the result of collaborative efforts. It was mentioned already throughout the day before. There's a lot of public funding going to research and development. There's academics who spend time on innovative approaches, early research. There's tax breaks, there's grants, there's monopolies, position, etc., which are granted by society. There's patients who are involved in trials. There's doctors who spend time on clinical trials. So we need to take that into the equation as well when we're negotiating prices to really know who takes what kind of risks, who spends what on research and development. I can give you a very clear example of this, which has recently come to attention. I'm sure Bas knows more about it, about lutetium octreottate, a medicine that was developed at the Erasmus Institute in Rotterdam, to a large extent at least. And after Novartis bought the exclusive rights to this medicine, it's a cancer treatment. After Novartis bought the exclusive rights and bought all the single supplier of the products, they increased the price by 5 until €92,000 per treatment, and now it's not available anymore to Dutch patients, while it was developed in an academic hospital in the Netherlands. So this to give you as a clear example of how the public is also involved. The public sector is involved, and we need to strengthen this in our negotiation positions with pharmaceutical companies and have a more informed debate about who is involved and who is doing what when we negotiate prices, so that we can take back control over the prices. Last point. There is a very clear opportunity happening next month at the World Health Assembly in May. The World Health Assembly is the General Assembly of the World Health Organization. So it's basically where all the member states meet and discuss different resolutions, proposals, how to move forward in different domains. Italy has proposed an international agreement on transparency, on prices of medicines, on cost of research and development, as well as on clinical trials. In clinical trials, I did not touch upon so much today. I wanted to focus really on the prices and the cost of research and development. On clinical trials, it's more about the effectiveness, to make sure that all the data is really being published on clinical trials, also the one that may show that the medicine may not be so effective. But so this international agreement would provide more transparency on the prices that countries pay to share information, give a role to the World Health Organization to facilitate this, and also force pharmaceutical companies to be more transparent about their cost of research and development. There was one more point that I forgot to mention, sorry, on my previous slide. There is a report, the Lives on the Edge report, which, on the cost of research and development, which cites 19 sources. So there are 19 sources about the cost to develop a new medicine, and this is a range between 30 million and 2.9 billion. So it's a huge difference about what is being estimated by different researchers, some of them affiliated to the industry, some of them entirely independent. So it also shows that if we want to have a more informed decision about what is a proper, fair price, that also means that we need to get more insight, what is everybody spending, and that report gives more detail on that. So feel free to look at that report on our website online. But going back to the World Health Assembly, I really want to make the case here that transparency serves better access to medicines, more affordable medicines, not only in developing countries, but also here in Ireland. We heard the case from Michelle today about hepatitis C treatment, how she said when we got more information from what different countries were paying, that actually helped their own negotiation position, etc., and was part of some of the breakthroughs in getting better access. So it's also for Ireland, here in Ireland, that it will help to get better access to medicines. So I really would urge the Irish government as well to support this resolution at the World Health Assembly in May this year. Thank you, and have a look on our website if you want to have more information on some of the reports that I cited there. Hello, my name is Dimitri Eynikel. I'm working for Médecins Sans Frontières, Doctors Without Borders, as an advisor on access to medicines at the European Union in Brussels. So I help to get patients better access to affordable medicines by challenging some policymakers who can help us really in this cause to create better access to medicines for patients. I'm here today to talk about the importance, obviously, that patients do get timely access to the medicines that they need. Medicines are not just like handbags, but they're really important for people's life and dignities to be able to survive and to be able to live without any suffering. But in order to do that, we also need to have a fair system of how we get access to that medicines, and particularly the price is an important aspect. Very often we hear, whether it's in Ireland or in developing countries where MSF works, that the price is too high and that we cannot afford these medicines. So what is a good price for medicine? That's a discussion that we need to have as well. And a first indicator of having a good price or knowing whether a price is fair is to know at least what other countries are paying. And that's what I talked about here today. We need to get more insight about what countries are paying, and we as citizens should have a right to know whether governments are paying for some of the medicines that we need for our treatment. That's the first level, to just get some transparency and get some information to inform ourselves, to have a real debate about the prices of medicines and treatments. This was my second time on the panel here at the conference on access to medicines in Dublin. And this is the second time that I really enjoyed this panel discussion here. I think there's a high level of speakers. People are very well informed, speak with a lot of experience, personal experience as a patient, as a researcher, as an advocate on access to medicines, to speak from their own experience on what could potentially be some options, solutions to improve access to medicines. And I think this is really the way forward. We should continue with this kind of engagement to discuss also with government officials who is here about the policy options that they have taken, as well as the challenges that they face as well, because it's not easy for them either to get access to the right treatments or give access to the right treatments.
Okay, last question. So do you think you were at last year's conference or this year's conference? Do you think in another year's time, or next conference, do you think things will have improved? Do you think we're
on access to medicines?
Yeah, and where we're seeing a biologic, or is there still more challenges?
I think it's a continuing challenge in access to medicines, but I see that spirits are developing, people are thinking about options and creating new ways to get better access to treatments. It's not only about the budget anymore, like increase the budget. People are pretty well aware that we cannot indefinitely increase healthcare budgets, so we need to do better with the money that we have. We cannot, as society, keep spending more. So what can we do to get better access with the 2 treatments, with the budget that we have? And I think in that sense I saw definitely progress as well in the last few years at the conference, and I'm expecting as well by next year there will be new ideas on the table with different speakers. This is really the way to go forward. All right, good.